Hey, this is Doug Field, CEO of the Institute for Healthcare Consumerism. Welcome back to the segment. I'm joined here by our co-hosts Ron Bachman and Jonathan Field. The topic of this segment is that ever-popular private exchange discussion. And joining us to lead that discussion with us today is Brian Clay, Director of Private Exchanges with Krauter and Company in New York. Brian, good morning.
Good morning. How are you?
Good. Nice to have you here.
Thank you. Thank you for having us.
Hey, can you start out by giving our audience just a brief background on Krauter and Company and your place in this space?
Yeah, absolutely. So Krauter Company, we're a boutique brokerage. We handle employee benefits, property casualty, management liability, overall risk management for our client base. We're headquartered here in New York. We've got 10 offices across the country.
Okay.
And we define our client base truly as middle market with an average employee count of 100 to 5,000 lives. We have some larger, some smaller, but that's really our core business. Also, a large part of the business that we do is within the private equity space, helping our clients manage mergers and acquisitions activity. And then myself, here within the firm, I'm focused within the employee benefits practice. Specifically, I'm the Director of Exchange Solutions for Krauter Company. So I've really been tasked with analyzing this market, the emerging market of the private exchange space, and really looking to define Krauter Company's strategic approach to that space.
Well, welcome to the Wild Wild West, Brian.
Exactly.
Yeah, give us your view of what you see across the private exchange space right now.
Yeah, I think you hit the nail on the head. It really is. It really is a Wild West. It's very much an emerging market. There are close to 100 players out there right now, sort of jockeying for position within the space. We've seen tech companies, we've seen payers, carriers emerge into the space. Obviously, brokers setting up exchanges. So it's sort of a flock to market is what we're seeing.
What's the most confusing factors that you help your employers with as they because I think a lot of this is CFOs, light bulb goes off, they turn around and say, hey, we got to figure this out. And they reach out to you, what do you see as some of the most confusing factors that they're wrestling with right now?
Sure. I think one of the first question marks is, is this a single carrier exchange? Is this a multi-carrier exchange? There's a lot of sort of murkiness about that. So we're spending a lot of time with our employer groups, sort of educating them on who would be a fit for a multi-carrier exchange, who's not. It seems in the industry that the industry has drawn a line at about 3,000 eligible lives to make a multi-carrier exchange viable. So that's a big part of the conversation. And a lot of the conversation is also about the architecture of a private exchange. So conceptually, I think everybody's there. I think everybody understands, basically what an exchange is. But what's the architecture of it? Who's actually going out and procuring the plans, which in most cases is still the brokerage community. Where do the contracts sit once you sign? And what we're seeing is that employers are, still being the plan sponsor and signing contracts. Big question mark that we're seeing is, what's the time frame on implementation? And what we're finding is that the runway for rolling out an exchange is a bit longer than a traditional renewal process. And so helping them manage through that. And then, one of the other areas, near and dear to the CFO heart, if you will, is what's the cost of these private exchanges? So what we're seeing from an admin perspective is somewhere from between $7,000 and $9,000 per 100 employees per year in cost. And, I don't think a lot of employers are focused on that when they're, talking conceptually about private exchanges.
So, Brian, Ron Bachman here. What is the uniqueness about your approach? You're a broker out there, and a lot of brokers have even established their own exchanges, maybe offer some exchanges. What makes your program unique in this developing marketplace?
Yeah, as we went through the, sort of the vetting process on this, at the core of our business, what we do, we're consultants. So to put it simply, we objectively evaluate various solutions for our clients. So in the traditional sense, we look to vet carriers, plan designs. wellness vendors, TPAs, in some cases payroll vendors, PEOs, benefit admin systems. So what we've done is, instead of going out and setting up our own exchange like a lot of brokers have done, similar to the locked-in approach, we're applying our core competency as a consultant to the private exchange space to make sure that our clients are making informed decisions. I think the space is really in its infancy right now, and our conclusion that we came up with is that it's too soon to hitch our wagon to a singular horse at this point.
So are you, when you're doing the consulting as to where they go, you're getting your I'm trying to understand your business model. You're getting your consulting fees for doing that. If you place them, are you also then the broker of record?
Typically, yes.
Okay. So in deciding where to go, tell us about some of the tools that you're using and how it helps the employer determine what is the best exchange for them to go to, because it sounds almost like you're an independent agent, if you will, but you're just applying that to a brokerage type model where you're helping them select, and then you're staying involved with that process throughout.
Yeah, no, absolutely. I think the first step, the first analysis that we do is sort of crunching numbers on, I'm projecting what it would look like to take, your population today and put it down into a new environment within the private exchange environment. So our initial conversations are surrounding the analytics, what we think the finances will look like if you put a population into an exchange, both now and in the future going forward. Then from there, we look to get a sense, what is the employer looking for? Are you looking for a singular carrier exchange, a multi-carrier exchange? From a funding perspective, are you partial to self-funding, fully insured scenarios? Benefit designs. What sort of carriers are you looking for? So we go through a process of A, looking at what are the nuts and bolts on the finances, and then B, what are you looking to accomplish? And then from there, we look at the exchange world, if you will, and we look to line up the best solution for them.
Hey, Brian, you've got a very unique client base around private equity that you alluded to before on the program. Talk to us about private exchanges and maybe unique opportunities that brings to the private equity space.
Yeah, certainly. I mean, when we look at our business, we're tied largely to the acquisitions that these private equity companies are making. So our client base is, all over the place from an industry perspective, from a regional perspective. So some of the early conversations at the private equity level that we've been having are, look, this is an emerging market. It's certainly getting traction. Where can we apply this within your portfolio of companies to start fixing your costs? And at the end of the day, the idea of going into a defined contribution scenario with a fixed budget for the employer and then the private equity firm that sits above that group or that employer is very attractive. So we're definitely getting a lot of eyebrows raised in the private equity space as we watch this market emerge.
Brian, on the employer side, we hear a lot of hype going on around anything that's new, and then we have to sort of see how effective the different options are, and we're going to have some winners and some losers. But we're clearly moving in this direction of private exchanges. How are you seeing the current movement, and what do you see as the prospects in the future? Is it something that's really booming right now across the country? Are there certain geographical interests more than others? Certain sizes that are more interested in making these changes? Give us a profile of what you see the market movement being.
Sure. Right now, we're in full swing with our January 1st, 2015 strategy discussions with our client base. So I think that the employer community overall is showing a big appetite for looking at this. Everybody wants to see what the private exchange is, what it looks like and feels like, and that's across industry, that's across that's across size, that's across region. I think the latest numbers that I've seen in survey data is 75% of employers are interested in exploring this. the reaction that we're getting, as we start speaking with them, some employers are asking, is there too much choice from within an exchange, and they're a little bit skeptical about can an exchange decision-making tool get the employee to the right place. But we're seeing a big flurry of let's look at it. Now, when we sit down in these strategy discussions at the end of the day, we say, realistically, what is it? What are your thoughts on adopting this for 2015? We find that about 25% of the people that we're talking to are ready to go and really interested, and the majority of those 75% or so are saying, look, we want to take another lap. We want to let this market mature a little bit, and we want to keep an eye on it.
Yeah, we see kind of the same thing. I think there are some hidden surprises that coming out of the market. Accenture came out talking about 2014, where they originally said 1 million participants would be in the exchange in 2014. Their latest number saying 3 million. So I think we're going to probably see some of the same. But we too look ahead to 2016 and see that as maybe the big explosion year where companies are ramping up.
Yeah, and I think the Fortune 500s are obviously, we've seen the bigger companies jump first, if you will. I think the middle market where we play, it's there's a little bit more trepidation. Sure.
Does that mean you're seeing more of the single carrier model? I keep hearing that seems to be picking up speed because of the complications of the multi-carrier and risk adjustment flows back and forth and formulas make that happen. Are you seeing something different, or tell us what you think about the multi-carrier versus the single carrier?
Yeah, certainly we're seeing more in the single carrier format. The multi-carrier format, I think, is even less mature than the single carrier format. I think there's an overall hesitancy based on some of the issues with the public exchanges to go that far, if you will.
Right.
Hey, Brian, we've got about a minute to go, and I want to give you the opportunity to kind of wrap this up from your point of view and leave our audience with one to two takeaways.
Yeah, absolutely. So I think the biggest takeaway here is this is very much an emerging market. There are close to 100 exchange options out there right now. There doesn't appear to be a true national solution that has fully stocked shelves, for every carrier in every state. Major carriers haven't really jumped into this space yet, although Cigna United they're starting to dip their toes. So it's emerging. I think that's a key takeaway. I think from an employer perspective, the success of an employer's ability to the success of an adoption of a private exchange is based on their ability to pick the right exchange. There are many criteria to consider: funding, plan selection. Each exchange that we work with has its own strengths and weaknesses, and really identifying what those are relative to the client's goals is sort of paramount to the process. And then I think the last takeaway that I'll leave you with is that adopting an exchange doesn't excuse an employer from the challenging aspects of managing a benefit offering that exists today. There's still a need to manage claims, ensure compliance, communicate with employees, maintain a competitive contributions, manage the employer spend. Those all still exist within an exchange environment.
That's very well said, Brian. Really appreciate you taking time out of your day with us today. Great segment. Have a great weekend. And to our audience, stay tuned for the next segment of Healthcare Consumerism Radio.
Hey, everybody. Welcome back to Healthcare Consumerism Radio. This is Brent Macy, Managing Director of the Institute for Healthcare Consumerism, along with CEO and founder of the Institute, Doug Field. Joining us on the program today is one of Mike's colleagues, Lissa Thompson. She's the Senior VP and Chief Consultant at Lockton Benefits. Welcome, Lissa.
Good morning, and thank you.
Tell us, now we just had a conversation with Mike around some of the things that employers need to be looking at around exchanges. Kind of give us your brief background there at Lockton, and tell us a little bit more about the industry and kind of where you see the exchange market right now.
Okay, great. Well, as you'd introduced, I'm the chief consultant for the benefits group at Lockton, and my chief role is to lead and help develop our resources with innovative solutions, make sure that those are made accessible to our client consulting teams. My background actually started out in the math and the actuarial side, but I've been doing consulting for almost 30 years. My view of exchanges as they exist in today's market, and I think that we'll see a lot of development over the next few years, is that exchanges work in certain circumstances, but the most critical items that you need to do is develop the need, develop the issue, develop what you're trying to solve for, and make sure that the solution meets all of those needs.
Lisa, this is Doug, and welcome to the program.
Thank you.
Tell us a little bit about the specific client that you want to talk about today. Who they are, the industry, and kind of some issues that you were trying to help them solve.
Great. Okay. Well, in 2013, Lockton developed a very specific private exchange for an industry. One of our clients, Entertainment Partners, had been a client for some 10 or 11 years. Realized that the entertainment industry, of which they are a payroller, they're one of the largest depositors of W-2 information to the United States government. They handle a lot of both union and non-union members from a payrolling perspective in the entertainment industry. Mm-hmm. They realized that the Affordable Care Act, or ACA, was going to have a tremendous impact on the entertainment industry. So to tell you a little bit about why they needed an exchange in the industry and why our client felt that a private exchange would be the optimal solution. If you think of ACA and the requirement that you are required as an employer to cover 95%. Now, of course, that's been pushed to 70% for 1 year. You're required to provide coverage to 95% of your population, and that must be qualified and affordable. And you look at the entertainment industry, and I'll give you an example of a multimedia entertainment client. They might handle theme parks, magazines, and productions. And when I say productions, it could be feature films, it could be documentaries, it could be TV shows, it could be reality shows, it could be all sorts of different kinds of productions. They have different staff needs across their industry. So what they distribute for benefits for a theme park or a magazine is going to be very different than production. In production, you have two kinds of workers, union and non-union. About 75%, give or take, of the market is unionized, of those production workers are unionized. So if you think of the directors and actors, the screen actors, the writers, they all are part of unions, but there is about 25% of the production market that is non-unionized and had never had benefits. So if you think of this multimedia industry, that non-union production workforce, in almost all circumstances, will make up more than that 5% that the government allowed you as sort of a buffer from an ACA eligibility perspective. So they had to go through and say, how am I going to provide benefits for this workforce that I've never provided benefits for? And that's pretty much industry-wide, that the non-union workforce had not had benefits. And you also have to consider that this workforce is highly migrant. I will work on one show for 3-4 months, and then I go to another show. And the successful people in the entertainment industry continually work one production after another. So the management of that workforce and the development of whether or not they're eligible for coverage became a problem. And then how do I provide meaningful benefits for these people when they're literally transitioning from multimedia company A to production company B to feature film or reality TV, and we may have people who go among 7 shows, some of which the shows are owned by the same multimedia company. Sometimes there are 7 different ones. So it's a very, very unique issue in this industry. In early 2013, the CEO of our client, Entertainment Partners, contacted us, and they said, what can we do? We recognized that there were some things that we needed to solve for. We needed to provide some workforce management, some eligibility management. We needed to have a platform that was easy to onboard and offboard as production companies started up for a feature film and then close down for a feature film. It had to be a process that was fairly simple. And we needed to have coverages or product or benefits for the workers that could transition through the lifetime of their year of multiple productions. So we very quickly realized that a marketplace for the industry was the best solution. Provide something so that when you have a production that's given a budget which will include ACA exposure or requirements for benefits, that you have something that you can plug into. It gets up very quickly, understands the needs of the movement of the workforce, and provides benefits that they literally can take from one company to the next because they're the same benefits and the contributions required for the employees are the same. So if I leave company A, I may be out of work for 2 weeks. I'll pay for that directly. But then when I start to work for company F, I continue the same benefits. If I've met my deductible, I've met my deductible with company F. So we have the seamless transition of benefit platform for the entire industry.
Well, that makes a lot of sense. Now, did Entertainment Partners offer health care benefits before? Or was this a new?
No, they did not. They had never been asked by the entertainment industry to provide benefits. It's a tough nut to crack.
Yeah.
There's a lot of administration, a lot of processes, and a lot of compliance and underwriting that you have to do in the background. So there really had never been a need pre-ACA.
But the marketplace, it also gave them this opportunity to execute this model for their clients.
It did, and when you think about the industry, this was I'll use the word virgin population. They really had never had benefits, so we really didn't know much about their utilization patterns other than through the demographic risk, which we of course could measure. So having carriers come to the table for this was not. It wasn't a 1, 2, 3. There was a lot of development in that process.
That sounds like it. Now, who was your exchange partner in this endeavor?
We actually developed the exchange.
Okay.
Lockton was the principal architect. We got a lot of insight from our client entertainment partners relative to the needs in the process development, but we hand-selected benefits administration system, decision support, direct pay advocates, call center services, communications. It was all custom developed because it was such a unique need. We did look at already established exchanges, some of the better known exchanges, but once again, it would have been very clunky because you have to have a very facile onboarding, because when you get a green light for a production, you've got to be ready. No. You can't have a lot of transition. You have to have a process that's built for uploading their eligibility and getting them moving.
Now, listen, when you got this up and moving, what was the feedback from one, the employees, but also the associated businesses underneath this group?
Great question. Well, had we not had pushback on ACA on July 2nd, 2013, and then again in February, of course, the more that the government changes the rules, the more the perception or the need is deferred.
Right.
Had we not had the deferral on July 2nd of last year, every one of the entertainment industries would have had to have a solution by January 1, 2014. And we were up and ready, by the way, by January 2014. We were enrolling people last November. But it pushed the need. So right now, we have some big names as clients. I haven't asked for their permission to name them, so I will refrain from doing so. But we have a lot of proposals. The clients that will have to comply in 2015, those who will have an issue with the 70%, and also those companies that realize that to compete now in the industry, they have to offer benefits because the specialty production companies will be offering benefits. So we're going to see a huge uptake in January 2015, barring any additional delays by the government.
Alyssa, if what kind of advice would you give, an employer out there or an affinity group who's looking to maybe, put this in play, private exchange?
Well, I think that private exchanges, especially customized private exchanges, are a very effective tool. If you have to understand what it is you're trying to solve for. Mm-hmm. Is it cost? Is it outsourcing? Do you need flexibility? Do you need multiple funding methods? Do you need multiple carriers? What is it that you're trying to solve for? Is it some sort of a transition period? We're doing private exchange, customized private exchanges right now for a number of private equity companies. Mm. We also have a large union that is looking to expand a private exchange for non-union clients. So it depends upon the need. I would look very carefully at the commitment that you wanted to make. Some of the established exchanges may be good solutions, but you have commitments and obligations. You need to look at, carrier commitments, carrier obligations as well. There's a lot to be developed in exchanges over the next few years, and I think that they definitely have a good run and a good opportunity to bring solutions to a lot of employers. I, like Mike, believe that customized exchanges, at least in the initial phases, may be to the better benefit.
And one of and we kind of echo that. We actually built privatehealthcareexchanges.com and are updating that with all the different exchanges that roll out. It seems like there's 5 a day that roll out into the marketplace. So it's a fast-moving market. So we echo all that you said, and we really appreciate you joining us on the program today, Alyssa. Have a great weekend, and to the rest of our audience, stay tuned for Healthcare Consumerism Radio.